So I want to tell you about a relatively new problem that can present ophthalmology as bilateral periorbital angioedema and swelling, and it's called alpha-gal, and it stands for galactose. And this alpha-galactose is a form of adult onset allergy that's acquired, and it occurs after having a tick bite, which is a super weird stem. So if the stem says, I have acquired allergy to red meat after tick bite, that is the characteristic feature of alpha-gal, alpha-galactose, IgE mediated inflammatory disease. So it presents to us as periorbital edema. It's bilateral. It looks like an allergy, like contact dermatitis, and the patients have puffy, swollen eyes. It's itchy because it's IgE mediated, and some of the patients can go on to full-blown anaphylaxis. So the weird thing about it is the tick, the Lone Star tick, bites you, and the allergy develops to non-primate mammalian red meat, and that's because that alpha-gal is acting as the antigen to reduce tolerance. So it's adult onset, because when you were a kid you ate red meat, nothing happened to you, but now all of a sudden you're allergic to red meat. And it's an allergy because it's IgE that is the antibody. It's acquired because you had to have the exposure, and that exposure was a tick bite that reduced your oral tolerance to the alpha-galactose. And so the thing is called alpha-gal. It's a relatively new thing on the etiology for bilateral new onset periorbital angioedema. It can affect your mouth as well and lips, but it's an angioedema thing. And the characteristic feature, it happened after a tick bite.